I'm Kristen. I'm one of the founding board members of Faces Tomorrow, and I'd like to take a minute to introduce you to some of the team members that we bring. When we think of surgeries and our medical missions, we often think of just the operating room, thinking of the surgeons and where the magic happens. But to make the magic happen, we have a really big team that comes and supports us. We have the OR nurses, we have the recovery room, we have the floor nurses. We also bring a dental team, speech, and along the way we have a lot of different support staff, admin.
Hi everyone, I'm Stacy Wilcox. I'm from Marin, California. I work at Marin General Hospital with another nurse here that's on the floor. I'm a pediatric and neonatal nurse there. And here in Bohol, I've been working with two other floor nurses, and I feel like our main job here is pretty much traffic control. We're working with an excellent crew of hospital nurses, volunteer nurses, and a foundation that's doing all of our translations. So we just have to make sure that everybody's coming in and getting bedded, that we've got their pre-op done and all their orders, at the same time getting people to the OR and from the OR, and making sure all their medications have been parceled out and ordered, and just really watching over the care. But I feel like we have such really good support from the team here that it's different, that we have to be hands-off and really ask permission if we're going to be stepping in with these patients. So again, it's just great to be here. It's different. It's probably a little more humid than I'm used to back at home. But other than that, it's just been a pleasure to work with these wonderful families, and I just feel so lucky and fortunate to be here.
My name is Stephanie, and I'm on the admin team for this year's mission. There's 3 of us, all taking a very important role in making sure things behind the scenes get done. We're kind of the paper side of the patient. We make sure the chart gets to where it needs to be, that the patient's with the chart, that the beginning of the chart, the end of the chart are all in sync. We like to make sure that the floor knows what's going on with the operating rooms, and the recovery room knows what's going on as well. A big part of our job is making sure that the donor's money is spent appropriately. We have to buy supplies for the patients, we have to buy supplies for the staff, we have to pay the hospital, we have to coordinate meals for the people who are working. We work really hard to maximize donor money. We want to make sure that we can help as many people as possible.
My name is Amy Merendilia. I'm a registered nurse from the Cleveland Clinic. I'm really interested in doing this mission because I used to live in the Philippines over 30-some years ago, 20-some years ago, and I feel that this is a way of giving back to the people that to this country that I've lived with. Now, patients in here are also, in terms of monitoring patients in here, it's basically the same as in the United States. Trish and I are the 2 nurses working here in the PACU, and we just tag team. You know, we get the patient settled in, hook them up to the pulse ox, and then we get the family right away as soon as we get the kids settled in. And it's just nifty to see how the parents' reaction is when they first see the child, to see the difference between before surgery and after surgery. Although there's still a lot of swelling, and Christy sometimes show them pictures before they go to surgery.
My name is Louis DeWitt. I'm a nurse anesthetist, and I work in Sacramento, California. And I came on this mission as part of the anesthesia team. We have 4 anesthesia providers. I have myself and 3 other pediatric anesthesiologists. Now, the difference between myself and the other part of the team is that I'm pretty much a workhorse. I stay at a station and I'm doing cases all day long. The pediatric anesthesiologists are here to help me start the case, but they're also seeing patients in the clinic, they're doing pre-op evaluations, and they're also seeing the patients afterwards, out on the floor. And they write orders out on the floor. Now, some of the differences, well, some of the things that we encounter when we come here is we have to provide anesthesia for 4.5 days during this mission. And we are bringing a lot of equipment, but we can't bring 100% of what we need, and we're actually relying on the hospital, the facility, to provide some of the equipment. So for example, anesthesia machines, suction, and some supplies, the beds, IV poles, hardware. On this mission, there was a question of whether we should bring our new traveling ventilator. And it was like, should we take it? Should we take it? No, we'll take it. You know, we may use it, we may not use it. It's always good to have a backup. And additionally, another monitor. And it turns out it was a really good thing, because when we went through and we're setting up on the first day, we have to check out all the anesthesia machines to make sure everything's going to work. and one of them had a broken valve.
Hi, I'm Michael. I'm one of the OR nurses here with Faces of Tomorrow. At home, I'm an OR nurse at the Cleveland Clinic. We have 5 OR nurses here. Some of the challenges we face are, in addition to our regular scrubbing and circulating duties, we also are in charge of all of our equipment and all of our instrumentation. So we bring all of our bags back to the ORs, we do an inventory, we see what we have a lot of, what we don't have a lot of, what we need to be careful to not use up early on in the mission, so that at the end of the mission we have used all of our equipment.
Thank you for letting us share a little bit about the magic in our team that makes these beautiful missions happen to change people's lives. Thank you so much to all of our donors and supporters, everyone who follows us on social media, and all of you that support us year-round to make these missions happen and change the lives of these people forever. We have a little thing that we like to say in our mission groups, a little chant at the end to make us all inspired and happy and feel good about all the work that we've done. And it goes something like this: 1, 2, 3, go FOT. Thank you.